keep your cholesterol low and all of that?
Well, there's much more to it than that, but cholesterol is a small part of it, and that has to do with diet and other things as well. So the first 10 years of my work, we didn't concentrate on anything really other than exercise. And we had great results. However, I had a few patients that did everything right that I asked them to do that showed evidence of further blocking, and that was distressing. Some needed more bypasses or some had heart attacks. And occasionally there might be one that might have died in that time period. And I realized that I wasn't stopping the blockage as I had thought I would be able to do. And I told patients if they did everything that I told them to do, that the blockage shouldn't get worse. Obviously, I wasn't stopping it. And then in the late 80s, at about 11, 12 years into my work, I found out that there was a research done actually in California by Dr. Dean Ornish, and he presented at the American College of American College of Cardiology in 1989 in New Orleans, and showed that you could actually unblock that stuff. And that was an eye-opener for me, a life changer. Of course, I had to change a lot of what we were doing. We had to add more parts to the program other than just exercise. And what were the parts? Well, in addition to exercise, that program included also diet, which was quite extreme by many standards because it was basically low-fat, pretty much totally vegetarian. It did allow a cup and a half of non-fat dairy. And with this, and doing the other two components, which were stress management, and the one that I might not have thought was important, group support and connection. The ability for people to connect is very critical. And I suspect just from what I've heard of your podcast, you must also agree with that. And certainly veterans and so on, I can imagine that that's a very important part of their life. So these were new things. And I took a workshop in 1993 as a patient. I wanted to feel it as patients felt it in California. And I came back from there and I was sold on it. And I started running workshops. I did 50 of them, where I brought in about 12 heart patients and their spouses and trained them in an all-day workshop on how to do this. So basically diet, exercise, stress management, and group support are the components in that program. And if you look at the patients that took that program and took the workshop and compared it to others who didn't take the workshop, the outcomes are clearly better as far as, recurrence of further blockage and causing angina. Angina is a pain in the chest caused by lack of oxygen. And that lack of oxygen is called ischemia. You don't need to remember the word, but it's called ischemia. And that happens all over the body wherever one starves for oxygen. In the brain, that threatens a stroke. And if part of the brain dies, that's called a stroke. And in the heart, if part of the heart dies because of that lack of oxygen, that's called a heart attack. And my job is to try and get these arteries as open as we can and keep them open. And certainly the evidence of being able to unblock those arteries was shown by Dr. Ornish and many others since then. It takes an extreme effort. And a lot of people and a lot of doctors really feel it's undoable because people won't do this. And I think I agree with that. Most patients won't do this with most doctors because most doctors, their only tools really are the surgeon uses a knife and the regular doctor, cardiologist, family doctor, pretty much their only real tool is a prescription pad. So my tool when I went into this new field was all of a sudden something very different. It was a lifestyle change. And if people do more of it and enough of it and include all of these things, the ability to actually unblock the artery blockage.
Wow. So that is awesome. And how that we can we discover that problem before it becomes more worse, or they discover that when you have already a pain or problem in your heart?
No, I wouldn't recommend waiting until you got a pain. I recommend that, people are aware of this. And I tell my patients, and I have patients of all ages, of course. When I started, I was such a young guy, and most of my patients were old people, like they were over 50. I call that old then. Don't call it old now. And we now know that the offspring of patients who have had heart disease have a much higher chance of getting this disease. And in my own experience, it's not uncommon to see the offspring getting it 10, 15, 20 years younger than the father or mother did.
Wow.
To work on prevention is very key to this. Waiting until your arteries are bad enough with bad enough blockage that you're having angina, that's already almost too late.
Oh my
Yes.
Because
goodness.
your arteries need to pretty much, on average, need to be over 70% blocked before the downstream tissue feels that lack of oxygen. 70% is already, a lot more than you'd want to have if you want to try and start, reducing that blockage and preventing it any further. The younger the
Wow.
better. The younger the better to start with these efforts.
So hold on. So Kia, hold on, please. So what is the name of the test that people have to do in order to see that you have problem in the coronas
Well,
arteries?
there are tests, a whole range of tests. Uh, I mean, a family doctor takes a history, finds out if the patient has symptoms, and asks about their family history about heart disease, and asks them about, it looks at their lab results, cholesterol, takes a part in this, and diabetes, blood sugar intolerance, or blood sugar abnormalities. These are all a big part of this, of blocking arteries. I mean, the risk factors for blocking arteries are, well, for a part of life, being a male, but women catch up very majorly after the menopause. Uh,
Mm.
so increasing age and a family history of heart disease, increasing age, that's three. Uh, Serum lipids, which includes cholesterol, triglycerides, being less than optimal, diabetes, lack of regular exercise, obesity, um, smoking. I haven't kept count. There's the 10 I usually talk about as a rule. I'm not sure I got them all or not there, but I'm pretty close. And so if people have any of these things, they should be working at reducing those risks. People with high blood pressure should work at everything they can before, unless they're so bad that they need drugs right away. I recommend doing lifestyle changes, uh, with diet and exercise. And I recommend that for diabetes. And overweight people generally can have more evidence of hypertension. Hypertension means high blood pressure. Some people have this idea that hypertension means that you're hypertense and it has something to do with stress. It does not. Hypertension means high blood pressure, nothing to do with stress.
That's a good explanation for hypertension, right? Because I've heard
Yes.
that before too. And since it runs in my family, high blood pressure, I have a great question from Tendai, who says that he exercises quite a bit, but diet is his biggest challenge. He says, I know for some reason it's the exact opposite. I try to eat healthy and grow my own vegetables, but slip up sometimes. How much is hereditary and genetics a factor, though? It's a great question.
A difficult question, really, because what might be deemed genetic may not be totally.
Mm,
Because you
wow.
see, young kids, they learn how to eat and how to live in their parents' home, and the parents teach them how that all goes. So patients that come to me with a family history, a significant amount of that may have just been environmental and how they grew up and how they learned the habits of their parents. However, they are both factors, and are all the other factors that I've mentioned, and all needs to be addressed, really.
Wow. So, okay. So if you have any of those things, then you probably should consider having a lifestyle change.
Right.
But if you have some of those things, or maybe even if you don't, what are some signs and symptoms, or how could you determine whether you have, heart problems or
Okay.
potential heart
And
problems?
you just reminded me, and I want to remind you or let you know that I tend to get going, and there's so many pathways I can take. And if I end up not asking a question, please give it to me again. That can happen. I just
Okay.
I just
No
get
worries.
once I get rolling, so many pathways I could go. And I forgot to finish that question that was asked. And that question was, how do we test for this? And I said that a family doctor does the simplest testing of asking and doing lab tests and getting sort of a historical examination idea. And then we can take patients. What I do is I do stress testing. And stress testing is basically taking patients for a test drive. I put them on my treadmill or an exercise bike or a new step machine or any number of other rowing machine, depending on, most of the time it's on a treadmill, because for most of us, walking is what we do. Uh, Many older people want to walk. They don't care so much if they can row a boat or can row a rowing machine, or if they can pedal a bike. They want to be able to walk. So I recommend that walking be one of the main exercises, especially as people get older, because maintaining the ability to do a particular activity and exercise is going to depend very much so on how much of that you do and how you develop your fitness to continue with that. So from the normal stress test, the next one after that is probably what we call the nuclear medicine test. And in our country, we don't do PET scans so much, but I've sent patients to Houston, Texas, to Dr. Lance Gould, who I'm not sure if he's still in practice. I suspect he still might be. And he was the originator of the positron emission tomogram. But in Canada, we have a lesser type version of that machine called nuclear stress testing, where you inject a nuclear chemical that shows up in the heart, and it shows the areas of the heart that are starving for oxygen versus those that are not, by kind of using a Geiger counter kind of a device that shows it on a scan. So the patient that has the starvation for oxygen, you can see that there. And I don't do that on everybody, because on most of the patients, I can see that it's not there, or I can see that it's definitely there, and I may not go on to that test. But if it's in between, I would use that test. And then the granddaddy test is probably the coronary angiogram. An angiogram, angio comes from Greek or Latin, I'm not sure which, meaning blood vessel, artery. And gram means test, I guess, angiogram. And an angiogram puts dye into the artery while they're x-raying you, and the dye is opaque in x-ray. As you know, when you x-ray bones, they show up compared to soft tissue, if you can see if there's fractures and so on. And well, the dye that is used in the angiogram is very radio opaque, means it shows up very white, because keep in mind that an x-ray is actually a negative image. So whatever is white is actually more dense. So that's how we do angiograms, and from that we make decisions. And there's a lot of other things to talk about, really, because the modern medical world is not always handling all of these things in my opinion, the best way. In that, a carpenter uses a hammer. I think we'd all agree. A surgeon uses a knife. A physician uses a prescription pad, largely. So if you go to somebody, they use their tool. And I feel that those tools are not the best tools. I'm not saying drugs shouldn't be used. I'm not saying surgery shouldn't be done. But they certainly should not be the first thing we think about. I think changing people's way of living, changing their level of fitness, changing excess weight if we can, changing whatever we can to reduce the risk factors. And that makes a big difference in outcomes.